Hello, everyone, and welcome to today's lecture. I hope you all had a good weekend and look at the bright side. This semester is almost over. So, today we are talking about um, human development, and we're speaking specifically about the young adult through the older adult. And here we go. So adulthood is divided into three age groups. There's young adulthood, which is usually between the ages of 18 to 34 years. Middle adulthood, ages 35 to 65, and older adulthood, which is ages 66 and older. And these stages are very individualized and can vary depending on the person themselves. So at each stage, people are tasked with achieving specific developmental milestones. We learned that in the first half of the developmental lecture. Various researchers have developed theories and tasks as people transition through life stages. It's important to remember that when aging occurs, the body goes through physical changes that are universal and irreversible. Some examples of physical changes can lead to illness. Some of those changes will lead to illness, disease, and they can be the primary cause of functional loss during old age. Declines that occur may be due to environmental factors, lifestyle behaviors, and or diet. So here are some theories on aging and adult development. You have the wear and tear theory, and that's where the body wears out from use. Organs and organ systems are worn down by toxins in the diet and in the environment. Then you have the aging at the level of DNA and body cells. That is a theory that says that DNA is gradually damaged, and free radicals are the cause of cellular damage. There is the cross-linking theory of aging. This theory states that protein fibers that are normally separate from each other link together, causing damage and certain disorders. And then there's Gould's theory on adult development. And that is basically when someone frees themselves from childhood restraints in order to establish their own personal identity. You can read about all these theories in the chapter that was assigned in your book. Young adulthood, now we're talking ages 18 through 34. This is a transition phase. It's when social changes occur, and many young adults are faced with responsibilities regarding careers and marriage and beginning a family and becoming financially independent. Physical changes occurred, the body has developed fully, and people reach their peak growth. Cognitive changes can also occur. People are able to display empathy, which is where hopefully you are all at, being in an empathetic in an empathetic training program that's teaching you how to be a nurse. Nurses are very, very common people who display empathy on a normal basis. At this time in their people's lives, there's also an increase in rational thinking and problem solving skills. And if you think about it, compared to past generations, young adults today have more options to consider as they branch out from their shelter of their parents' homes. When they're branching out, they have more decisions than they ever used to have. Some of these decisions they face include college, employment choices, gender identity, and sexual preferences. Social changes are often influenced by society's values, beliefs, and expectations. Health promotion in young adulthood emphasizes on wellness activities, focus on disease prevention, and completing lifestyle assessments. This is really important. When we're looking at a lifestyle assessment, nursing should focus on identifying factors that lead to unhealthy lifestyles and increase the risk of illness and injury. Young adults need to assume some responsibilities for decisions that can affect their current and future health status. And these are why we do these lifestyle assessments. We're looking at family history, mental health, environmental and work-related exposures, military service, and travel abroad. Those are assessed to determine if people are exposed to any kind of health hazards. We also want to assess someone's sexual orientation, whether they're having safe sex practices, whether they have a history of STDs, if they're utilizing pregnancy prevention, if they're experiencing domestic violence, and substance abuse should all be included in these lifestyle assessments. Health risks and concerns during young adulthood. These include alcohol, which you will often see abbreviated as ETOH. This accounts for 50% of all cases of pancreatitis. Chronic consumption can lead to esophageal varices. That's when, usually from a lot of vomiting, gastritis, cirrhosis, and hepatitis. Those can all be the result of alcohol overuse. Cigarette and illicit drug use. Use of tobacco rises with age. Illicit drug use is often associated with serious health and social consequences. And some of those consequences include injury, illness, disability, death, crime, domestic violence, and decreased school and work productivity. We were talking about domestic violence. We want to make sure that we are monitoring for that. Both physical and mental health are affected, and this often can result in substance use disorders. Sexual activity is always a concern during young adulthood. Risky behaviors can lead to negative health outcomes, such as sexually transmitted diseases. Some of those STDs include gonorrhea, chlamydia, herpes simplex, HIV, syphilis, and HPV. Accidents and violence. Those are leading causes of death in young adults. These include motor vehicle accidents, suicide, and homicide. Texting, eating, driving under the influence of drugs or alcohol, and distracted driving are very high contributors to motor vehicle accidents. Then we move on to middle adulthood, and we're talking ages 35 through 65. This is a time of adjustment for most people. They start to see physical changes, wrinkles begin to appear, hair thins out, the waist thickens, muscle tissue and strength tend to decrease. Often people have to adapt to challenges such as career changes, children leaving their home for college or work, and caring for their aging parents. Cognitive changes can occur. Crystallized intelligence refers to skills that depend on accumulated knowledge, good judgment, experience, and wisdom. Fluid intelligence represents basic processing skills, such as the speed in which information is analyzed and the capacity of working memory. It's important to remember, middle adulthood is individual and no two people experience it in the same way. If you're looking to see more specific changes as far as physical changes go, there is a table in your fundamentals book that you should have reviewed in the chapter. I think it is table 18.1 in use. So you can review that. It's a pretty lengthy table. Something to be familiar with. This is Erickson's theory of generativity versus stagnation. Generativity is it means reaching out to others in ways that guide and give to the next generation, such as mentoring and volunteering and being involved in community. This usually happens in generally well-adjusted adults. And ethnicity and culture plays into this. Stagnation is when someone becomes self-centered and narcissistic. That's when people put their own comfort and security above others. As far as health promotion goes, we want to make sure that we are encouraging adequate rest, encouraging leisure activities. The CNS system slows, resulting in decreased speed of motor and sensory receptors. So encouraging activities that stabilize intellectuality, such as cultural or artistic activities, or traveling, or reading, or crafting, or anything that stimulates this, will help keep the CNS system active. We want to encourage exercise. We want to encourage adequate nutrition. We want to encourage people to have a satisfactory sexual functioning. We want to encourage these patients to reduce alcohol and tobacco intake. And we want them to have regular health screenings, such as blood pressure checks, colonoscopies, or prostate, mammogram, pap smears, depending on whether the patients are male or female. Health assessments should always include psychologic as well as physiologic problems that can be experienced in middle adulthood. This is the slide on health risks and concerns during middle adulthood. Risks includes cancer. This is the second leading cause of death in the US. Cardiovascular disease. This can include hypertension, hyperlipidemia, atherosclerosis, myocardial infarction, also known as a heart attack, arrhythmias, and angina. Diabetes is also a risk. Obesity is a risk. Mental health issues and mental health changes are always a risk. This can include depression and anxiety related to stress. Concerns include health screenings. These should address adequate rest, leisure activities, regular exercise, healthy diet, and cessation of alcohol and tobacco products. We kind of talked about that on the previous slide. And then health promotion, including regular screens, and those tests that we mentioned on the slide before. It's important to remember that the leading causes of death in mental health in middle adulthood are cancer and cardiovascular disease. Non-fatal injury risks include falls, motor vehicle accidents, unintentional overexertion, and injuries related to being struck by or against objects. Domestic violence should always also be addressed with these screenings. Relationships during middle adulthood tend to change. You often see marriage or divorcing occurring. This is a period when marriages often experience turmoil. Grandparents raising grandchildren. These are called skip generation families. This often occurs due to parental substance abuse, emotional illness, or physical illness. These parents might not be able to care for their children anymore, and the grandparents are taking over. Middle adults often are caring for aging parents. This support includes emotional support and occasionally financial support. Overload can occur, and caregivers often feel stressed and have increased health risks due to caring for others while neglecting their own needs. A lot of times these are the children that are caring for an older parent, and they're forgetting to take care of themselves. Then we get to older adulthood. These are people ages 65, 66-ish and older. Couple of interesting facts. Older women outnumber older men at an approximate ratio of 1.25 to 1. Each older adult is unique, and understanding perception of wellness and illness is essential in planning their care. So we need to figure out what their understanding and perception is in order to correctly help them plan their care. Ageism is an important term you might hear. It was coined by Dr. Robert Butler, and it really defines prejudices and stereotypes applied to older people on the basis of their age. And these perceptions are based on the fact that older people are unproductive. We all know that that is inaccurate, and older people can be very productive. But ageism still occurs, so it's important to keep that in mind. Changes that affect internal functioning often occur simultaneously with changes that can be seen. So you will often see changes in the internal body as well as noticing things on the outside. Cognitive changes can occur in the presence of dementia and or Alzheimer's disease. And this is where people often struggle to maintain their self-esteem and independence. It's important to remember that physical capabilities are not the same as they were in younger adulthood. People's hair turns gray. That is due to a loss of melanin. Skin becomes thinner and less elastic. Their reactions become slower and senses are less acute. You see people with declines in eyesight and hearing and things like that. The brain decreases in size. It will still function the same in the absence of dementia or Alzheimer's disease. It will still function the same, but it does decrease in size. The heart will pump less blood through the body. The respiratory system is less efficient. And additionally, the digestive system produces smaller amounts of digestive juices. And if we're having smaller amounts of digestive juices and we're not digesting our food, that can lead to constipation. Developmental theories in adulthood. You have Erickson's theory of ego integrity versus despair. Ego integrity, that's people who view life as a wholeness, and they receive satisfaction from past accomplishments and are accepting death as a completion of life. Versus despair. Despair is one's belief that they made poor choices during life and wish they could do it over. And then you have Havinghurst's theory. This theory states that people try to adjust to decreasing physical strength and health. Retirement, they're trying to adjust to retirement and reduce income. They may have death of a spouse. They may be trying to adjust to having satisfactory living arrangements and adapting to social roles in a flexible way. Health risks and concerns during older adulthood. Risks include CVA, also known as a stroke. This is the leading cause of long-term disability among adults in the United States. Cardiovascular disease, including AFib, MI, and hypertension. Cancer. Older adults are less likely to be screened and often go undiagnosed or are discovered, or their cancer is discovered in a later stage. Respiratory diseases, this includes COPD and tobacco smoke exposure. And in this day and age, it could be marijuana smoke exposure, especially in Massachusetts, where we live, where marijuana is legal. It's important to consider that as smoking exposure as well. Musculoskeletal disorders are risks. People often have joint limitations due to osteoporosis, osteoarthritis, rheumatoid arthritis, and or gout. And then diabetes. The risk for diabetes increases with age. Again, our concerns are always health screening. We want to focus on early detection of disease, and this includes dental, eye, and hearing screenings. And then health promotion. The focus is primarily on looking for atypical symptom presentations so issues don't go undiagnosed. Um, and we always want to assess for mental health issues resulting from changing roles, as children often become caregivers for older parents. I know that was really hard for my parents to rely on their kids as they grew older. So that's an important thing to keep in mind. That is the end of my developmental presentation. I hope you found this helpful. If you have any questions, please feel free to reach out. Send me an email and I will answer the best I can. I hope you have a great rest of your week and a fantastic weekend. Bye.